Hello there, welcome to the last installation of Putting Dr. G on the Spot in the month of May, where we talk about various forms of infection and how such viruses and bacterial infection can cause impairment of sexual and reproductive health. And the very last virus we're going to talk about actually is HIV. Obviously, there's no vaccine in HIV, but HIV treatment and also its perception has changed tremendously since the 1980s. So several decades down the line, what has changed? For men and women who are living with HIV actually has certain issues. So that itself, the infection itself can intermittently reduce their immunity, can sometimes cause problems such as neurological problems such as neuropathy, and also sometimes cause impairment. However, men and women living with HIV also has tremendous benefit from the treatment of the actual antiviral. The antiretroviral therapy, or ART itself, has significant suppressions on the virus. So the undetected virus in their body actually will have no impact on their sexual and reproductive health. First of all, the virus is not transmissible when it's not detectable. So therefore, sexual activity itself is completely safe. However, other forms of sexually transmitted infections such as gonorrhea, chlamydia, syphilis, and hepatitis B are still transmissible. Number two is that when the actual viral load is low, all the inflammatory changes such as infertility, erectile dysfunction, and low testosterone itself doesn't really affect you, and therefore you live normally. Number three is that the fertility is definitely not affected. So in fact, men actually taking the antiviral has significantly better sperm quality. It's because the HIV itself is non-detectable, and therefore the suppression of spermatogenesis doesn't occur anymore. Therefore, in other words, people who live with HIV on the antiretroviral itself has no difference in their life expectancy and also quality of life as far as their sexual and reproductive health. However, there are two types of people who live with HIV actually need to deal with the antiretroviral therapy. For example, men who take antiretroviral therapy may have several problems. For example, someone who's got renal impairment needs to be a bit more cautious, and also men who actually take antiretroviral therapy may have a little bit of issues with cholesterol and may have a bit of small issues with upset stomach and low libido as a result of side effects of medication. However, the newer generation of such medication has absolutely no impact on most of these, and most people actually have no side effects whatsoever. The other group of patients who are the partners of individuals living with HIV also take PrEP, which is pre-exposure treatment. With these group of antiviral, it also has a similar side effects such as upset stomach, some people have a bit of nausea and vomiting, and it had mild issues reducing the testosterone level, and lastly, sometimes it might even cause a slight impairment of cholesterol. With such low exposure, with such low side effects, so people who take pre-exposure prophylaxis has absolutely no impact side effects as far as sexual and reproductive health. For the new month of June, we're going to talk about something quite different. We had enough of all the infection talks. We're going to talk about sexual activities as far as frequency of sexual activity, and also what the research tells us what happens if somebody who actually don't have sexual activity at all. So stay tuned for next week's Putting Dr. G on the Spot.